Well, it's that time again. It's after work. I am still Patrick, and I'm still driving a rental car. And I had 5 visits today, but one of them I ended up not having to go to. Somebody else took care of it. But I had a very long visit that involved the intricacies and the complications of providing home care to somebody who resides in an assisted living facility. There were a couple of little complications, like the patient has a contract with the assisted living facility to provide nursing to administer medications to them, and then overnight there's no nurses there, so they have CNAs administer the medication overnight. Now there are like some really arcane and seemingly arbitrary restrictions on exactly what the CNAs are allowed to do. And the problem comes from sublingual medications. Sublingual medication is usually a very, very small amount of fluid, like a quarter of a cubic centimeter or a half of a cubic centimeter, that's supposed to absorb directly into the bloodstream through the mouth, through the soft tissue in the mouth. And the nurses' aides are not allowed to administer sublingual medications using a syringe, an oral syringe, even if the syringe has been pre-filled by a nurse. They have to put it in a little cup and mix it up with some juice so they swallow it. But the residue sticking to the side of a medication cup could easily be a quarter of a cubic centimeter. The drug could all be there. It becomes less certain whether or not the patient has actually taken the prescribed dose of medication. So the alternatives are to cancel the contract for med control and just teach the family how to do it, because it's a very simple regimen, and that's something that I'm going to consider doing later. And then the other one for the pain medicine is to use an automatic CAD pump to deliver the medication automatically subcutaneously. However, they are not yet taking enough of the morphine to justify that. So I had a long talk with the nursing supervisor, who is actually a hero of mine. I worked with her in the nursing home before. She's a super nurse, really made a big impression on me when I was a newbie. And, talked about the ins and outs and the regulations and the wrinkles and stuff, and came to a pretty reasonable, came up with a reasonable plan for the next few days, which is really nice. But this nurse was really amazing to work with. She had a lot of critical care experience, so she's no joke. She really knows her stuff, and she encouraged me to attend a critical care consortium that they have. Not a consortium, what do you call it? A convention, I guess. A critical care convention or something that they had at one of the casinos, that they do annually at one of the casinos. But this nurse worked with me while I was on the floor, and she was supervising, and she was pregnant at the time, and it looked to me like she wasn't doing very much, while I was out running around. But at the end of the day, we leave a taped report, on an audio recorder for the next shift. She knew so much about what was going on that unit that she taped a report for me and the other floor nurse, for us. She just sat down with a recorder and just went down the list and explained exactly what was going on with each person, and was just totally in control of everything. I mean, it was really impressive to listen to. Wow, she really does know what's going on. Yeah, very interesting, inspiring person to work with. So it's always nice to run into people that like that are in other places. Yeah, this will be my first actual patient on my full-time caseload who lives in an ALF. But I used to do visits in ALFs when I was per diem, but this is the first time it's mine. Back is killing me. So I handed in a couple of assignments at the last minute for school yesterday. No, it was just one, because I did one yesterday. I did one 2 days ago, and I did another one yesterday. Then it was a one-line question for the theory and professional roles in nursing class, nursing 530. It was was just like, what do you think the nurse's obligation to society is in 200 to 250 words? Which wasn't as much of a stumper as the, tell a story about somebody that you've met who's a good Samaritan and what that means for your life or whatever, in the core curriculum class that I'm taking concurrently with the nursing class. I think I got a couple more assignments due Friday and a couple more due on Sunday, so I'm in pretty good shape. It looked for a second like these classes would be a little bit harder, but I actually just got a big box with all my textbooks in it, and I haven't even opened the box yet. I don't need any of those textbooks yet. I'll be really pissed off if the whole 8-week cycle of both of these classes goes by and I don't actually open the box of textbooks. That would be kind of galling. Well, the claims adjuster from the insurance company of the person who hit my car told me she was going to call me today. I called her up because the car rental place, I told the car rental place where I was planning to bring my car in to get it fixed. So the car rental place, Enterprise Rent-A-Car, has been calling that repair shop trying to figure out where my car is, and then eventually they called me and I was able to tell them, well, no, I haven't brought the car in yet because they haven't established liability yet. I'm not going to bring it in until I know they're going to cut me a check. Because if they don't cut me a check, I'm probably going to bring it somewhere else. I mean, the place I'm going to bring it is like a really good auto body shop. I might have to bring it somewhere cheaper if they end up not paying. But since I did not get a ticket and the person who hit me did get a ticket, I'm pretty sure it's a sure thing. This will be the first time I've ever gotten a payout from insurance, and it's not even my insurance. Well, one thing I'm not looking forward to is cleaning my car out before I bring it in. I assume that's something you have to do. I work until 4, but today I didn't get out until 5:30, and 5:30 is the latest I can drop it off. So, it's gonna be a little bit of a hassle. Ooh, it's snowing. That's cool. Well, that's it for now. Pretty standard day, really. Nothing too interesting going on. Oh, I can't park in my driveway. I gotta park out in the street. Park out in my street in the snow. Well, but what about the plows? A conundrum. Maybe I will park in the driveway. It's just that there's this stump in the driveway that I keep scraping up the bottom of the car on. I got insurance on this rental car, so it's not that big of a deal, but it's just annoying. Alright, that's good. Alright, until next time.